A profile of health insurance coverage for Mississippi adults, a review of 2019 data. Every year the Center for Mississippi Health Policy reviews data provided by the American Community Survey, the Medical Expenditure Panel Survey, and the Integrated Public Use Microdata Series to create a summary of health insurance coverage for Mississippi adults. To create this profile, the center groups the data using several demographics: age, education, employment status, income, race, ethnicity, and parental status. This video will focus on a few of these groups, but all are published on the center's website. First, we will discuss age. Age affects an individual's eligibility for coverage. This review focuses on adults aged 19 to 64 years old. This range is selected because these adults are working age but too young to receive coverage from Medicare. Almost one-fifth of adults, aged 19 to 64 years old, are uninsured. This makes Mississippi's rate of uninsurance higher than the national rate of uninsurance by a little over 6%. The highest rates of uninsurance were experienced by adults aged 19 to 25 years old, while the lowest rates of uninsurance were experienced by adults aged 45 to 64. Adults, aged 45 to 64, also had the highest rates of public coverage. Employment status is another important demographic. In this review, we broke this demographic into full-time, part-time, and unemployed. In 2019, most working adults in Mississippi had private health insurance coverage either through their work or personally purchased. Unemployed adults in Mississippi, 41.4% were covered using public health insurance, 34.1% had private health insurance, and 1/4 lacked any health insurance coverage at all. Over one-third of uninsured adults are not working. However, 2 out of 3 uninsured Mississippi adults are employed, with almost half working full-time jobs and nearly one-fifth working part-time jobs. Parents working part-time, and childless adults have the highest uninsured rates. Another demographic that affects coverage access is income. Income was measured using the federal poverty level. In 2019, approximately half of uninsured adults in Mississippi live below 100% of the federal poverty level. Adults below 100% of the FPL experience the highest rates of uninsurance. In Mississippi, non-elderly adults are only eligible for public coverage if they are low-income and pregnant and/or the parent of a minor child, blind, or disabled. Approximately one-third of Mississippi adults at or below 138% FPL are uninsured. If Mississippi chose to expand coverage under Medicaid, which is allowable under the Affordable Care Act, this group of people would become eligible for public coverage. If you want to read more about health coverage data for non-elderly adults in Mississippi, the full chart book can be viewed and downloaded on our website. The Center for Mississippi Health Policy is an independent, nonpartisan, nonprofit organization that provides objective information to inform health policy decisions. To learn about health policy in Mississippi, visit our website or follow us on Facebook, Twitter, and Instagram.